So our next speaker, I was talking to Joseph, like, how do I even introduce this guy? I mean, Tom has been part of the recovery movement since the very beginning. He has been a huge mentor to many of us. And, I think that on the program it says Michael Duffy was supposed to speak. He couldn't make it, but Tom is more than an excellent person to fill his shoes. I'm not going to even try to do any more introduction. Tom can introduce himself. Tom Hill.
Good morning, everybody. Well, it's Saturday morning, and here we all are in this classroom to learn. Jason's going to put the slides up. My name is Tom Hill, and I work at a place called Altarum Institute right now, and we do technical assistance for a Samsa contract called Access to Recovery. And the piece that I'm here with my colleague Liz Burden, and she's going to be facilitating a workshop after lunch. And what we do is we have two grantee cohorts. One is the peer-to-peer cohort, and we have 21 grantees there across the country. Two of them are in Texas, one in Austin. Communities for Recovery is one of our grantees. And the other is the Association of Persons Affected by Addiction in Dallas, Texas, APA. So those are two of the 21 grantees. And then we have a new grantee initiative called Recovery Community Services Program Statewide Networks that is funding the work we're doing here today. So we've worked with Jason closely in the last year since that grant started, and are just really, really proud of the work that Recovery People has done, culminating in this first year of this great conference, the Recovery Capital Conference. So welcome, everybody. This is a great thing. And I'm going to talk a little bit today about the new recovery movement. It's not really new, but it's new-ish. And is there a clicker? I can probably do it. Oops. So I also want to let you know that I'm a person in long-term recovery, and that means that I haven't used alcohol or other drugs for 23 years and some change. And really, because of that is why I'm doing the work I'm doing today. I wasn't supposed to be doing this work, but plans changed with recovery, as it does for many of us. All of a sudden, you're called to do things that you never realized that you would be even capable of standing up and doing, like standing up with a microphone talking to a lot of people. So those are all skills that I've learned in recovery. I wanted so in 1998, I got recruited to work at the Lesbian, Gay, Bisexual, Transgender, LGBT Community Center in New York City to be a project director for this brand new grant from Samsa, the Substance Abuse and Mental Health Services Administration, called RCSP, Recovery Community Support Program. It's 1998, so it's 2015, right? 1998, I took this job. I was like, oh yeah, I'll do that. Had no idea what it was going to be about, and it was organizing the entire state of New York, people in recovery, to speak out about recovery and advocacy and community education, this whole new laundry list of things to train people to do. And there were 19 grantees across the country. Two of them were from Texas, El Paso Alliance, and APA, as I said earlier, in Dallas. And there were other folks all over the country, different populations, different groups, and they would bring us together twice a year, and we would sort of compare notes and learn together. And we would all come together and say, I tried doing this, 7 people showed up. We had an event and 23 people showed up, and we got so excited because we were getting people out of the church basements and into like the light of day, right? And everybody that wasn't a part of this said, you are absolutely out of your minds. You will never be able to organize these folks. This community is unorganizable, and they're going to bring up the traditions, and they're going to say you can't do this. And so now it's 2015, and guess what? It's a whole different world. And it's been a very relatively short amount of time in this turnaround, although I've got a lot of battle scars in those 16 years to prove it. But what a number of things happened a few years ago that sort of came together in what I call a perfect storm. So we had ROSC. So we've talked about ROSC this morning. And ROSC is something that's been sort of percolating for about 10 years, but has sort of come to the surface in a lot of state systems and a lot of communities. The idea of having recovery-oriented anything was not even something that anyone thought of a few years ago. So, and then we had the Mental Health Parity and Addiction Equity Act alongside the Affordable Care Act, the ACA. And parity basically meant that your insurance had to cover mental health and addiction issues in the same way they covered physical health issues. Huge, huge. And at the same time, the Affordable Care Act opened up a lot of different kinds of systems for people in recovery that never existed before, people in or seeking recovery that never existed before. Managed care expansion happened state by state, not in Texas, but in many other states. Other states are, it's a political thing, so we're always pushing for I misspeak, the managed care expansion and also Medicaid expansion. So that's what I was talking about earlier. And then the maturation of peer recovery support services that really only started incubating around 2001 and now are at a level of sophistication that we're actually able to be players in all these systems in a way that we never were before. So that's a huge thing. And then there's been this whole movement in criminal justice and drug policy reform to be more recovery-oriented and a little bit more, we've got a long way to go, but there is movement in those areas. And then the recovery advocacy movement, we're going to talk about that. So all these things have sort of come together at the same time that have sort of pushed this movement forward. So in 2000, I told about 1998. So there were 19 grantees, and there were some other folks around the country that were very interested in what was going on. And in 2001, a few folks organized this national summit in St. Paul, Minnesota. And there were about 200 people that came there and really came together for 3 days and talked about what would a recovery movement look like, what would our part be in it, and really had workshops and discussions and really started to articulate what it was that we wanted to move forward. And so we talked about acknowledging the growing number of advocates, celebrating the diversity of the recovery community and many pathways. And I think that was when we first started articulating what many pathways actually meant and what it looked like. And then generate national visibility for recovery. That's cut off, I don't know. For people in recovery, their family and allies. It was like to pull people out of those church basements, the ones that wanted to step forward, to create venues for that to happen. So that was a huge, huge turning point. People went home with a great deal of excitement and started organizing on a local and state level. So who here does not know who William White is? So William White is sort of our poet laureate and sort of a great researcher and historian and a person who we really have relied on to give us a great perspective on what recovery looks like, what treatment looks like, what this whole new thing is about. And he spoke at that summit and said, many of us have carried a message of hope on a one-to-one basis. But this new movement calls for us to carry that message of hope to whole communities and to a whole culture. So to start talking about recovery publicly, not just behind closed doors. And he said, we will shape the future of recovery with the detached silence or with a passionate voice. It's time to do something. But it's time. And then he also said we need to find a way to tell all of them that today we are sane and sober and that we have taken responsibility for our own lives. We need to tell them to be hopeful and that recovery lives. So it's a whole new message he's talking about in 2001. Americans see the devastating consequences of addiction every day. It is time they witness close up and personal what recovery looks like. So people, to sort of disclose that secret that open secret to the entire culture and society. So this is something that was designed in 1999, and it was in my former boss's, now retired, June Gerdick. It was in her office for many years, and I inherited it when she retired. And so this was a dream of people who came together in that 1998 cohort to talk about a national movement and what people being visible and vocal in Washington, D.C. would look like. So this is 1999. And I think this was sort of modeled on the Million Man March. I think that's where that million thing came in. But that's now, as you know, a reality. So has anybody not seen The Anonymous People? Because that's been a game changer, and you can download it on Netflix now. So it came out a couple of years ago. A young filmmaker and a person in long-term recovery, Greg Williams, amazing guy, put together this whole documentary. And now we had a tool that we could actually talk to ourselves and to the greater world about what recovery looked like and what the movement looked like. Historically, it's a really great, it's 90 minutes, it encapsulates all the stuff that's going on, and it really was a game changer because people started showing it in town hall meetings, in movie theaters, in their communities, and they would have discussions afterwards with people in recovery at a panel like this that would talk about their experience of recovery in the context of that movie. And all of a sudden, light bulbs went off, both with people in recovery and people who knew nothing about it, or didn't think they knew anything about it. But then all of a sudden, like, well, wasn't Aunt Mildred, didn't she go to those meetings? All of a sudden, the open secret became common knowledge and common discussion. So this was a really big game changer 2 years ago. And now it's culminated in the rally on the Mall in Washington, D.C. that'll happen a week from tomorrow, October 4th. And whoever can be there, it's going to be making history. This is the first time ever that we have stood up as a people and made ourselves visible. It tears me up that this is happening. Whoever thought that we would be a national presence? So people keep saying to me, is this going to happen every year? Because I can't come this year. It won't happen every year. I'll tell you, the amount of work and resources to put this kind of thing together is amazing. But I hope it happens every 5 or every 10 years because we need to keep reminding the public over and over again who we are, what we stand for, and that we are the solution. So all of this is about advocacy, right? It's like there's a lot of stuff out there that needs to be changed. There's a lot of stuff out there that is not recovery friendly, and in some ways that's our own fault because we haven't been visible, because we haven't been vocal. And so this is our chance to step up in many, I'm not going to go through these, but many, many arenas and to represent who we are as a constituency. Whether it's in an elected official's office, whether it's with agency directors, whether it's with community forums, that we are now being called upon to be the change agents in this new movement. I do want to talk about the Comprehensive Addiction and Recovery Act, CARA, which is sort of on the books right now and being considered in Congress, and that's one of our big fulcrums in terms of advocacy because it really is indeed comprehensive, but it has two pieces that are particularly of potential benefit to the recovery community. One is about resources for recovery high schools and colleges and for young people in recovery. And the other is for building infrastructure for RCOs, what we call recovery community organizations across the country. And this is something that we've been advocating for a long time, and that it got dropped into that as a major thing. So politics is always such that you want to keep those pieces in there, but we want to keep advocating for the whole thing. So there's actually, following the rally on the Mall in Washington, there's an advocacy day on Capitol Hill the next day where people will be talking about this and other issues. This is just a little bit, I'm not going to go through this either. So I've been involved with the contractor for Samsa since 1998 as a grantee and then a contractor. And I just wanted to show you what and again, my bad with all these acronyms. I developed this slide for people at Samsa because I wanted them to know that Samsa had a strong track record in supporting recovery over these 15 years. And I think that's just really important to acknowledge that there has been federal leadership and really important allies in the federal government pushing these forward. I also want to talk about another game changer. So Tom Cadair is on the left, and he is a person in long-term recovery who is the senior advisor to the administrator at Samsa. And on the right is Michael Botticelli, who's our drug czar. Both men in long-term recovery, out loud and proud about their recovery in federal leadership, never heard of before, unheard of before. So this is huge in terms of our visibility, not only on the grassroots level, but at top-level official levels. And they're not the only ones, but they're the ones that I threw in here. Capacity and infrastructure building. So I talked about CARA, and I talked about the collegiate recovery movement, the high school recovery community, the movement of recovery community organizations run and operated by people in long-term recovery across the country. And the need to build up that network of infrastructure has been paramount in our minds in terms of having that network is so important, and the resource sharing that happens. So these are just some of the players that did not exist 10 years ago. All this has happened very, very quickly and in rapid succession. So we have the Association of Recovery in Higher Education. We have the Association of Recovery Schools, and Kristen Harper is with us here today. We have Transforming Youth Recovery. We have YPR, Young People in Recovery, organized across the entire country. Amazing stuff is happening. Faces and Voices of Recovery that grew out of that 2001 summit and has done the lion's share of work of pushing things forward. And through Faces and Voices of Recovery, the Association of Recovery Community Organizations, what we call ARCO. So again, that infrastructure, technical assistance, and resource building. And then the National Alliance for Recovery Residences, Jason Howe, who's been instrumental in pushing that forward. So ARCO now has 100 RCO members across the country. Some are local, some are state, some are national. They do an annual leadership conference and are really focused on providing technical assistance to build up the capacity and infrastructure of those individual RCOs, but also that network. Recovery supports, peer recovery support services. I think you all know what these are, but it's really important that these have become, they've gotten to a level that I don't think any of us thought they would get in such a rapid period of time. And so the idea of people in recovery helping people in recovery, and that being acknowledged as practice-based evidence is a huge, huge thing that we are now in par with a lot of other service providers. Recovery community centers. The idea of recovery community centers has taken off across the country also, that it's a hub for recovery community activities. There's a shingle outside that proudly says Recovery Community Center on Main Street. Nobody comes to the back door. People come through the front door. It's a way of really putting recovery on the map, and has provided a lot of volunteer and service opportunities for folks, and a lot of programming, including those kinds of social and recreational activities that we all need in recovery to be able to have fun without using, and to normalize that as something that a lot of us need to learn, especially in early recovery. I want to go back because I wanted to talk about, I think it got cut off, but part of the advocacy agenda has been building a research agenda. Because to do advocacy and to do services, we have needed a research base that we've never had. And so part of that has been building relationships with researchers and recovery-friendly researchers and recovery-savvy researchers like Dr. John Kelly in the back, who's going to talk today at 10:45. Those folks have been lifesavers for us in terms of pushing that forward so that we can have the data beyond just anecdotal kinds of things that we know work, but to have hard number data and within a research context is huge for us in terms of moving this forward. So we're really lucky to have Dr. John Kelly with us today, and he's going to talk, I hope, about recovery community centers, because that's one of the things that he is studying the efficacy of right now. So I'm going to go back. So recovery community centers, a huge, huge thing in terms of, we like to think of them in the same way we think of senior centers. And that, 40 years ago, there was no such thing as a senior center, and now every neighborhood and every community wants and has a senior center. And we would love to be in a world where there were recovery community centers in that same kind of way. Recovery in educational settings, both in high school and collegiate, so important that young people and people who want to access education in general of any age have a safe, supportive environment in which they can learn, in which they can socialize, in which they can build new peer networks. Very, very important, and amazing work that's been done in the past few years, both on the high school and the collegiate level. Recovery residences. We know one of probably the biggest, there's two biggest things people need in early recovery. They need money and resources, so they need jobs, and they need a safe, stable, sober place to live. And so there's been a sort of a shadow system of housing for many, many decades. And so one of the things that surfaced in the past few years was the development of NAR and establishing standards for recovery residences and organizing around NIMBY issues, so that when communities said, we don't want these folks in our community, there was vehicles that NAR has identified that people can fight City Hall, fight the county, fight the state in such a way that we can keep our people where they need to be in the community. And then just Oxford houses. Oxford houses are amazing, and that national network of Oxford houses is getting stronger and more sophisticated all the time. So we really are building capacity and infrastructure more and more each year. I just want to close by saying we've talked about services, we've talked about political advocacy, we've talked about community education, but there's been this cultural explosion, and I think the cultural part of every movement is, are there songs to sing? Is there someone to design the T-shirt? Do we have visuals? Do we have these kind of things that keep our movement vibrant? And also just sort of culturally sound. And there really has been this amazing explosion in music, books, plays, movies, television in our country and in other countries where recovery is becoming more and more of a reality and hopefully a household word. And never underestimate the power of culture to move that forward. And so we also have now this recovery-focused media. We have recovery cable television shows, radio stations. We have e-conferences, chat rooms, blogs. They're everywhere. If you go on the internet, people are talking about recovery in a way they were not 5 or 10 years ago. So the secret is out. And that can only ever be a good thing. So I want to end, and I just want to let you know that there is a new recovery movement. It is moving forward very, very quickly, and that you are all a part of it. You are all part of this history-making thing that's happening in our world, and be very proud of that, because we are not going to go back. Like, once you get out of the church basement and you see the light of day, you're a little hesitant to go back in the dark again. And that's not to say that the work we do in church basements should be diminished in any way, because that's all, I've taken advantage of that. I take advantage of that all the time. That's the work I do there. but it doesn't preclude the fact that I can be out loud and proud about my recovery, and the same for you. So the fact that people are actually in this new recovery movement disclosing their last names is a huge, huge thing. And it may not be for everybody. And it may not be for everybody right now. That people have the choice whether they want to come out about that or not, and we should never embarrass or humiliate somebody who chooses to remain completely anonymous about their recovery. That's okay. But for those of us that are willing and able to step forward and sort of carry the torch, it is that the world is going to change as a result of our work. So, so excited to be here for the next couple of days. It's going to be a great conference. The program looks amazing, and looking forward to being able to talk to you guys one-on-one and in small groups as the next couple of days unfold. Thank you so, so much.
Thank you so much, Tom. With our remaining time,